Good morning, ladies and gentlemen. It's my great pleasure to share with you what I find very intriguing case of acute cardiac glycoside poisoning. That's a recent case from our department. I have nothing to declare. The learning objectives of this case are to describe the red flags pointing to cardiac glycoside poisoning. And I would like to also summarize the indications for treatment with specific antibodies fragments. Our lady was a 64-year-old lady which was admitted to our CCU department after ingestion of foxglove leaves. Sometimes our patients are very inventive, so she prepared herself a smoothie made out of about 10 leaves, fresh leaves of a foxglove from her garden, mixed with water. And unfortunately, this was all in a suicidal attempt. At the time of her admission, which was about 6 hours after ingestion, the patient presented with fatigue, mild nausea, and vomiting. Her vital signs were notable for bradycardia. She had normal blood pressure and normal oxygen saturation. Her physical examination showed cyanosis of the lips, which was very prominent. She had mild diffuse abdominal tenderness to palpation, and other findings were normal. Her past medical history was significant for alcohol abuse. She was not taking any prescription medications. She had no allergies. Now, what's the differential diagnosis? As we might know, there are different plants which contain cardiac glycosides. These are all in digitalis genus, or Convallaria, or Nerium oleander, which is also quite famous. Then poisoning with beta blockers, calcium channel blockers, alpha agonists, they can all present with severe bradycardia and can mimic the same effects. From other differential diagnostics, we have to think about hypothermia, hyperkalemia, hypothyroidism, or sick sinus syndrome. The results of initial lab findings showed severe hyperkalemia, 5.5, with normal renal function. Her serum digoxin concentration obtained at presentation was within therapeutic range, 0.8, and decreased to subtherapeutic levels within 3 days. The chest radiograph was clear. Her echocardiogram showed normal systolic function, actually very good systolic function. And what was really interesting, and I'll show you in the next slide, was her ECG. The initial ECG revealed complete heart block with junctional escape rhythm of 50 beats per minute. And there was a distinctive digitalis effect with lateral T-wave inversions, short QT interval, and the typical scooped ST segments. So as you can appreciate, this is the actual ECG from our patients on admission with the prominent scooped ST segments, which are sometimes being described as very similar to the famous mustache of Salvador Dali, to remember. And this is with patient's consent. This is her photo on admission, where we can appreciate the severe cyanosis of her lips. The patient has been admitted to the CCU for continuous cardiac monitoring, of course, because of her complete heart block. She was treated with IV glucose with insulin for hyperkalemia. She was given antiemetics and oral proton pump inhibitor. The National Poison Control Center has been consulted, and together with our clinical pharmacologist, and several management options were discussed. The GI decontamination with activated charcoal was used despite the relatively long delay since ingestion, because it's been described that cardiac glycosides undergo enterohepatic recirculation, and they can also be absorbed by activated charcoal. Most importantly, antidotal therapy with antibody Fab fragments has been considered, But since the patient was completely hemodynamically stable and the data supporting the indication for these specific therapies are not as robust in plant intoxication compared to the drug intoxication, it's been recommended to wait and monitor the patient. In the follow-up, the GI symptoms and fatigue resolved within roughly 2 days. The cyanosis of the lips due to vasoconstriction remained up to 5 days. And the ECG changes we can appreciate here. On day 9, we can see sinus rhythm with just borderline first-degree AV block, and there is still persisting digitalis effect on the ECG. On day 14, this completely resolved, and the patient has been discharged on day 15. So just a brief note about this beautiful yet quite dangerous plant. Foxglove is a plant containing cardiac glycosides and with positive inotropic effect. Digoxin has been first described by Sir Wittering, and it's one of the oldest drugs still used in cardiology and still recommended in patients with heart failure and atrial fibrillation. Its mode of action is the inhibition of the NAK ATPase, which increases intracellular sodium and influx of calcium, which increases inotropy and contractility, causes increased vagal tone and smooth muscle constriction. So typical is the increased automaticity with conduction blocks. In conclusion, the clinical presentation of cardiac glycoside poisoning is usually nausea, vomiting. There could be a splanchnic ischemia, which can be quite dangerous, vasoconstriction, visual impairment, which is famously described in the literature with the yellow vision, yellow halo, which our patient didn't have experience. There could be any kind of arrhythmia. There is a very typical distinctive digoxin effect on the ECG, so just remember the Dali's mustache. And what I wanted to point out here is the Fab fragment therapy. So the digoxin level is not the main parameter when we are thinking about specific therapy. On the other hand, what is hyperkalemia, because this has been described to increase mortality. So hyperkalemia more than 5.5 is one of the indications for specific therapy. Then the second one is hemodynamical instability, and the third one is ingestion more than 10 milligrams of digoxin. The antidotes are Digibind or Digifab, which are usually readily available in bigger centers, and they are given intravenously. Thank you for your attention.
Thank you, Anna, for a nice presentation. I realized that all the fresh smoothies are not always good to our health. So this interesting case open for discussion.
Yes, I would like to ask you to your opinion concerning digoxin and nowadays treatment of chronic heart failure, mainly the patients with sinus rhythm. Does it have any place?
According to the current guidelines, digoxin is a second-line therapy for heart failure patients which are in sinus rhythm with congestive heart failure. They are not recommended for patients with preserved ejection fraction. In patients with heart failure and atrial fibrillation, they are actually a first line of therapy.
Yes, please.
In the United States, this stuff is like Digibind is like $5,000 a vial. Do you know the cost?
I saw 2,050 per vial, but we usually, the standard doses are usually 10 to 20 vials for a patient, so it is extremely expensive. Yes.
If no further questions or comments, thank you for all the presentations and the audience for the active presentation.